Hello friends, welcome to Creative Medicine. In this lecture, we will learn about.
Hello friends, welcome to a new lecture today. I would like to discuss about vasectomy in this lecture. Now, vasectomy is removal of a part of vas deferens. Removal of a part of vas deferens is called as vasectomy. What are the indications? The major indication is it can be for family planning, or second, it can be used to prevent epididymoorchitis. It can be used to prevent epididymoorchitis after prostatectomy. After prostatectomy, it is used to prevent epididymoorchitis after prostatectomy. These are the indications. Now, what are the contraindications? Contraindications, they can be relative contraindications or there can be absolute contraindications. The major absolute contraindication is if there is any suspicion of testicular tumor. That is one absolute contraindication because there is a increased chance of metastasis to the structure. So whenever there is a suspicion of testicular tumor, we never do vasectomy because we are just increasing the spread. Next, if it's a relative indication is TB epididymoorchitis, because if we do it in TB epididymoorchitis, this can cause a sinus, because we are making an incision, and that incision will cause a sinus and fistula. So we'll have to avoid it in TB epididymoorchitis. Now the patient is placed in supine position and you will give an anesthesia. Mostly local anesthesia is given with 2% of lignocaine. Local anesthesia with 2% of lignocaine is given. Then you will have to paint the patient with bethadine iodine. And then what is the procedure? The procedure is you will after draping and after giving anesthesia, you will have to feel the vas. This is the root of the scrotum. Okay, this is the penis. At the root of the scrotum, you will have to feel the vas between the index finger and the thumb. You will feel it like a cord. Once you have felt the vas with the help of the you will have to feel the vas. It feels like a cord, and then you will make an incision about 2 centimeters in the root of the scrotum. This is the root of the scrotum. About 2 to 4 centimeters incision is made, and it is deepened through the layers of the scrotum. Now you will introduce Alice forceps. Okay, Alice forceps is introduced into the incision. You have already felt the vas, right? Now you will have to with the help of the Alice forceps, you will have to hold the vas, or the spermatic cord is held, and then you will have to locate the cord, spermatic cord which is there. You will have to locate it, and then after locating the cord, the coverings of the cord are incised. Okay, and then after incising the coverings of the cord, you will have to cut the vas deferens. That is how you will have to divide. You will have to cut it by 3 clamp method. That is why you will have to look at the first. You will have to identify the cord, spermatic cord. In the spermatic cord, you will have vas deferens. So you will have, once you will incise the coverings of the cord, then you will find the vas deferens. You will have to just bring it out, and then you will have to apply 2 clamps, first clamp and second clamp. Okay, and then third clamp, and then between the first and second clamp, you will have to cut it. Again, you'll have to bring this part out. Okay, so that you will there won't be a passage between for the sperms to pass. So vas is cut between part A and B, and then it is sent for histopathological examination to confirm the vas. Our main aim is that we'll have to confirm this has vas deferens. Then the 2 cut ends, they are double ligated with silk sutures. Okay. Now closure, you'll have to close the suture, close the skin with 1 or 2 sutures, and then post-operatively you'll have to ask the person to rest for a few hours, and antibiotics and analgesics can be given. There are some complications, like there can be injury to vessels which can cause hematoma formation, or there can be infection. One more complication is a few days later there can be testicular atrophy. A few days later, there can be testicular atrophy. So this is one more complication. So these are the complications of vasectomy. There is one more condition, one more technique which is available, which is called as no scalpel vasectomy. No scalpel vasectomy, it is a novel technique to do vasectomy through one single puncture. Here it does not require any suturing. We don't do any suturing, we'll just puncture. With one single puncture we will do this. Here we use a special instrument to puncture the scrotum and grasp the vas deferens. The vas is cut and the vas is cut. Okay, this is about the vasectomy. Thank you guys for watching my lecture.
Thank you, and thank you for watching.